What if many of the chronic conditions people struggle with, like long COVID, chronic fatigue syndrome, CFS, fibromyalgia, and irritable bowel syndrome, IBS, are actually different faces of the same underlying issue? A major review published in Seminars in Arthritis and Rheumatism in 2024 dives into this very question. The findings suggest that these conditions may share a common origin rooted in neuroimmune dysfunction, with overlapping symptoms and a lack of clear organ damage. Let's start with long COVID. It was originally defined as persistent symptoms following COVID-19, even after the infection itself is gone. But researchers have found that when you exclude patients who suffered clear organ damage during severe COVID-19, the remaining cases of long COVID begin to look very similar to CFS, fibromyalgia, and IBS. That means we're not just dealing with lingering infection, but possibly with a broader systemic issue. The most common symptoms of long COVID include overwhelming fatigue, brain fog, muscle and joint pain, gastrointestinal disturbances, and poor sleep. Interestingly, these are nearly identical to symptoms seen in CFS and fibromyalgia. In fact, studies show that over 50% of long COVID patients meet the diagnostic criteria for CFS 6 months after infection. A significant number also meet criteria for fibromyalgia and IBS. So what's going on inside the body? Unlike diseases that show up clearly on scans or blood tests, these conditions do not involve classic organ damage. Instead, they're associated with subtle but chronic dysfunctions in the nervous system, immune system, and gut. For example, abnormalities in how the brain communicates with the rest of the body, like altered brain connectivity and changes in neurotransmitter levels, have been documented in all of these conditions. There's also evidence of autonomic nervous system dysfunction. Many patients with long COVID, CFS, or fibromyalgia meet criteria for POTS, a condition where standing up causes a rapid heart rate and dizziness. This is linked to small fiber neuropathy, a subtle nerve disorder that doesn't show up on routine tests but has real physiological effects. On the immune side, researchers found no signs of widespread inflammation, but they did find hints of immune dysregulation, like altered cytokine levels and reactivation of viruses such as Epstein-Barr. Similarly, gut microbiome changes seen in IBS are also common in long COVID and CFS. Another important finding, these disorders appear to be mind-body illnesses, not in the sense of being psychological or imagined, but in how closely physical and psychological symptoms are intertwined. Depression, anxiety, trauma, and stress are not the cause, but they may increase vulnerability or worsen outcomes. For example, people with pre-existing mental health conditions or loneliness were significantly more likely to develop long COVID symptoms. The authors of the review argue that we need to rethink how we define and diagnose these conditions. Rather than searching for a single cause or test, we should focus on patterns of symptoms and functional impairment. They propose new diagnostic criteria for long COVID that align more closely with how we diagnose CFS and fibromyalgia, excluding cases with clear organ damage and requiring multiple persistent symptoms for more than 6 months that interfere with daily life. Understanding these conditions as related rather than isolated may help improve treatment. Many patients have been left in the dark, told their symptoms are all in their head, or dismissed because nothing abnormal shows up on tests. But this review makes it clear their symptoms are real, and they fit into a broader pattern of post-infectious neuroimmune dysfunction. As research on long COVID continues, it's shedding light on conditions that have gone misunderstood for decades. And with that understanding comes hope for better recognition, better support, and ultimately better care.